Good afternoon, and thank you very much for joining us. In the spirit of starting on time, we're going to go ahead and move ahead. I'm Denise Vigno with Howard Center. We want to welcome you to our second annual speaker series in recognition and celebration of World Mental Health Day this Sunday, 10/10/21. This year, the Federation of Mental Health has chosen the global theme, Mental Health in an Unequal World, to highlight the disparity in access to mental health care around the world. And while we are fortunate to have a really strong system of care here in Vermont, the pandemic has surely stressed and strained everyone. This year, we've created a World Mental Health Day awareness campaign, fundraiser, and weekly speaker series in the spirit of shining a light on mental health with a focus on taking care of ourselves and one another. Shortly, we'll turn to Dr. Ravven's talk, Supporting Resilience in the Face of Unrelenting Uncertainty. But before we get started, I do want to take the opportunity to thank all of our sponsors who have helped to underwrite our events. You can see them all on the screen, and we want to give a special shout out to our advocate sponsors, the Marsh McLennan Agency, OnLogic, the University of Vermont Medical Center, and the White Light Foundation. We also want to offer a very special thank you to two of our longtime donors who are committed to supporting mental health in our community. They are generously matching new donor gifts and renewing donor gifts with an increase in recognition of World Mental Health Day. We're thrilled to have their support, some of which will go to our First Call for Chittenden County program and our other crisis stabilization programs. We are really, really close to rolling over $50,000. I think we're at 49 right now. So if anyone would like to contribute, please visit us at howardcenter.org. And now, just turning to a few housekeeping notes for today's webinar, you won't have access to your audio, video, and chat functions, but Dr. Ravven will offer a Q&A session immediately following her presentation, and you may ask questions through the webinar using the Q&A function on your Zoom toolbar. We'll also be recording today's webinar, and we'll make it available at howardcenter.org in the coming days. And now it's my pleasure and privilege to introduce Dr. Simha Ravven, our Chief Medical Officer at Howard Center. Dr. Ravven directs psychiatric and clinical care for the agency, and she joined in the midst of COVID. While it's not an easy road to make a transition during a pandemic, she's done a remarkable job with a kindness, compassion, and responsiveness that colleagues all around the organization speak about. In addition to her responsibilities here, she currently serves as the president of the Vermont Medical Society and is a clinical assistant professor of psychiatry at the Yale University School of Medicine and the University of Vermont Lerner College of Medicine. Please join me in giving Dr. Ravven a warm welcome.
Thank you so much for that lovely introduction. I so appreciate it, and I'm so pleased to be here talking with everyone. Bear with me a moment while I share my screen and so you can see my slides. Oh, and let me get to the, I gotta go back a bit. So good afternoon, and thank you again for the warm welcome. My name is Dr. Simha Ravven, and I'll be speaking today on supporting resilience in the face of unrelenting uncertainty on the occasion of World Mental Health Day. Denise gave a lovely introduction. I'm Dr. Simha Ravven. I'm the Chief Medical Officer at Howard Center and serve as president of the Vermont Medical Society, and I'm on faculty at the University of Vermont and Yale Division of Law and Psychiatry. I'm so very pleased and honored to be here with you speaking on this day. And as I started to think about what would be most relevant to talk about on World Mental Health Day, I really could not get around the idea of talking about COVID and how are we going to get through all this? How are we going to get through COVID and our current situation? And I started thinking about what is most relevant to our own individual mental health, caring for ourselves, and supporting mental health in our communities. The pandemic has radically changed our lives, and continues to profoundly affect our families and family lives, our work and workplaces, schools and social structures. Uncertainty has also felt like a really important thing to touch on. The challenges and difficulties this pandemic has presented in planning, really planning anything on an individual level or on group and institutional levels just cannot be overstated. We quite simply do not know what's coming our way. We are living with so much uncertainty. And the word that came to mind for me was unrelenting. The uncertainty is unrelenting. When we think things are reasonably predictable, we are shown that they are not. So today, I will share some of the data on the pandemic effects on mental health, and also share some of my own thoughts and reactions over the past year and a half. And I'll talk about some ways that we can respond and shore ourselves up to support healthy adaptation and coping. So I thought uncertainty was the word that came to mind for me. And I thought, well, what do we mean by uncertainty? So I Googled it, and I looked at what images came up when we look at uncertainty and when we search for uncertainty. And so we've got some interesting images here. Over in the left, we have uncertainty is a giant wave about to crash down on some unsuspecting person. Uncertainty is a big shadowy question mark. Uncertainty is a keyhole or a door. Maybe there's an opportunity there. The fourth one, that looks to me like uncertainty is a question mark made out of the COVID virus. The COVID viral particle is a giant question mark pummeling down on a little running person. Uncertainty is a fork in the road. And then on the lower left, uncertainty is the road dissolving behind us. So those are some images, and I think it's telling that the question mark of COVID came up just with the word uncertainty. And then I thought, what do we mean by resilience? And this superhero image appeared. So what about resilience? I told a friend that I was going to be talking about resilience in the face of uncertainty, and she said, yep, resilience sure is in the zeitgeist these days. So people may be a bit tired of talking about resilience. I can hardly blame anyone for this. Though if I could think of a better word, I sure would use it. So these are really difficult times, and we will really need and continue to need to be creative to figure out how to get through them. I wanted to share a few more images of resilience. This one came up second. We've got some people in business suits climbing up an iceberg, or maybe it's above the clouds with a flag. Okay. This was just with the word resilience. We've got somebody pushing against giant dominoes with, it looks like another COVID viral particle pressing down on the dominoes. Ooh, we've got somebody boxing, punching that virus out. We've got a rocket catapulting away from the virus. And this is the one I actually liked the most. We've got this big, beautiful tree that was toppled over, but found a way to thrive and grow beautifully after it was toppled. And I think this is a really beautiful image. So what exactly are we being resilient from? How has COVID affected us? What are we bouncing back from? So the Center for Disease Control have collected information on symptoms of mental illness and mental health sequelae of the coronavirus pandemic. So the coronavirus pandemic has been associated with many mental health challenges caused both by the disease itself and related to the mitigation activities or things we've implemented to stop the spread, like physical distancing and stay-at-home orders that we've experienced over the last year and a half. Symptoms of anxiety disorders and depressive disorders increased considerably in the US during, and these numbers show April to June of 2020 compared to the same period in 2019. To examine mental health, substance use, and suicidal ideation during the pandemic, the CDC conducted representative surveys of adults in the US age 18 and older in June of 2020. And as you can see here, 41% of adults reported at least one adverse mental health or behavioral health condition, including symptoms of anxiety and depression, 31%, trauma-related symptoms related specifically to people's pandemic experiences was about a quarter, and 13% of people either had increased substance use or started using substances specifically to cope with pandemic stress. So this is huge. This is really staggering. The CDC survey also found that, also looked at the percentage of respondents who reported having seriously considered suicide in the 30 days before responding to the survey. And that 11% of adults they surveyed reported seriously considering suicide in those 30 days. Younger people, ages 18 to 24, those who described themselves or identified as Hispanic or as non-Hispanic, Black, race or ethnicity, were more likely to report serious suicidal thinking, as were those who described themselves as essential workers or providing unpaid care to adults. Importantly, they did not collect data on unpaid caregivers to children. To tell you a little bit about the sample, quota sampling and survey weighting were used to improve the cohort representativeness and make it essentially look like the US population in terms of gender, age, race, and ethnicity. So how does this look compared to the prior year before the pandemic affected us? Do we see an increase? And in short, yes, we see an enormous increase. The prevalence of anxiety-related disorders increased threefold. Depressive disorders, we see an increase of 6.5 versus 24%. And those in suicidal thinking, 4% versus 11%. So this is a really big, an enormous change from the prior year, from spring of 2019 to spring of 2020. The CDC also collected data looking at August 2020 to February 2021. So the last months after this, and looking sort of at the more, I guess I would describe it as chronic phase of the pandemic adjustment or reaction. And in this period, there was a more modest increase, but still building reaction to pandemic effects. And during that time period, the percentage of adults with recent symptoms of anxiety or depressive disorder increased from 36% to 41%. And those reporting an unmet mental health care need increased from around 9 to 11.5%. The increases, again, were largest among young people, ages 18 to 29, and those who have less formal educational attainment and had less than a high school education. So this is staggering. These numbers really reflect that people are really suffering and struggling. And they have important implications for public health practice. This is really useful information, and these trends in mental health care can help us get a global view of what's going on, but also help us evaluate how to best target programs and interventions. What about children's mental health care? Or I'm sorry, children's mental health and COVID, and by extension, children's mental health care. The Kaiser Family Foundation conducted a survey of parents in May of this year, and 29% of parents felt that their child's mental or emotional health had been harmed in the pandemic. And the symptoms they described children experiencing were irritability, clinginess, fear, and difficulty with sleep and poor appetite. And as we've seen in our area, but also nationally, as more children really need mental health care who hadn't accessed it before, and those who had experienced mental health care needs prior had a greater need, access to care issues are increasing because demand is increasing. And access to care is something that has been pronounced difficulties with access to care long before the pandemic, particularly for children. So one of the questions here is, what is adaptive adjustment versus clinical mental illness? One of the important issues is really how to determine when professional help is needed and someone's adjustment to a profoundly difficult situation has not gone well. Andrew Solomon wrote in the New York Times last year, "Nearly everyone I know has been thrust in varying degrees into grief, panic, hopelessness, and paralyzing fear. If you say, 'I'm so terrified I can barely sleep,' people may reply, 'What sensible person isn't?' But that response can cause us to lose sight," he writes, "of the dangerous secondary crisis unfolding alongside the more obvious one. An escalation in both short-term and long-term clinical mental illness that may endure for decades after the pandemic recedes. When everyone else is experiencing depression and anxiety, real clinical mental illness can get erased and not be seen." He goes on to write, and I think this is an interesting way to conceptualize it. There are roughly 4 responses to the coronavirus crisis and the contingent isolation. He says, "Some people take it all in stride and rely on a foundation of unshakable psychic stability." This is my commentary here. I think that's something of a fantasy, but I'll go on. And he says, "Others constitute the worried well, who need only a bit of psychological first aid. A third group, who have not previously experienced these disorders, are catapulted into them. Last, many who were already suffering from major depressive disorder have had, and other disorders, that's my comment, these disorders have been, and their symptoms have been exacerbated, developing sort of chronic, acute on top of chronic symptoms or condition." And he goes on to say, and I think this is a really useful point, "The belief that things are not okay is reasonable. The belief that nothing will ever be okay, again, appears to indicate a clinical condition. A gradual adjustment to our changed circumstance is the appropriate trajectory. The feeling that every day this becomes increasingly unbearable is a pathological one." And he comments, "There is the thinnest of membranes between sensible and unreasonable." And he says of himself, "I know I have both, but trying to separate them is like untangling the Gordian knot." And he goes on to talk about how important engaging in his own mental health care, which for him was medication and psychotherapy, has been for himself and for his family and for the health of his family. And I think this points out the importance of seeking out mental health care and how effective and life-saving it can be. So it's useful to think of any disaster, including the COVID-19 pandemic, as having a psychological footprint. This is this slide shows a very literal interpretation of that, the footprint. I found this slide in the disaster literature, and it's a visual representation of the psychological toll of disaster. The psychological footprint here encompasses the effects of the loss of life, the ripple effects of illness in families and communities, disruptions in income instability, work and school, and isolation and disruption of social supports. And it got me to thinking about the psychological impact of the pandemic and grief that is outsized in comparison to the virus itself. And it brought to mind a story from my own family. My maternal grandfather's name was Robert Ravven, and he was born in 1918 during the 1918 influenza pandemic. And actually, the story was passed down in my family that he had an uncle who he never got a chance to meet. His uncle was named Robert Bloom, and that uncle died at age 18 in the 1918 influenza epidemic in Boston, which was a city that was really hard hit by the epidemic. And it affected the family so profoundly that 7 of the deceased Robert Bloom's siblings named their sons Robert, including my grandfather, Robert Ravven, and one sister named her daughter Roberta. So they all named a child for the youngest brother that they lost. And more than 100 years later, I know about this story and the profound effect of the grief on my family, and how each of my grandfather's siblings memorialized him, Robert Bloom, the one who died in the pandemic, by naming a child for him. So I became really curious about the mental health effects of the 1918 influenza epidemic. How did the 1918 epidemic affect people and affect their mental health? It's thought that this 1918 influenza pandemic is thought to have killed between 50 and 100 million people worldwide, and I've seen statistics of 2 to 5% of the world population between 1918 and 1919. And it turns out that it had a significant impact on mental health and mental well-being. Prior to this, in the 1890s, there was an influenza pandemic in 1890 to 91, which was called the Russian flu. And US physicians were beginning to identify long-term neurologic sequelae related to this 1890 Russian flu. And popular press of the time commented on the psychological symptoms associated with the 1918 influenza. A newspaper of the time reported that, as had been the case with the earlier influenza outbreak, quote, a swift loss of mental capacity and inability to think coherently is the most distressing symptom. They also commented on the longer term after effects, and an article entitled Influenza Depression in 1919 in the London Times said, one of the features of the present influenza wave in 1919 is the marked depression it leaves behind. The psychological effects of the 1918-1919 influenza became intimately entwined with its physical effects in the public consciousness. So at the beginning of our current COVID pandemic, many people thought about the Virginia Woolf novel, Mrs. Dalloway. Mrs. Dalloway is set in 1923, 5 years on from the global influenza pandemic that I described. And Clarissa Dalloway, or Mrs. Dalloway, is one of the survivors. In the novel, Mrs. Dalloway is joyfully preparing for a party in her home. Wouldn't that be nice, right? The opening line of the novel is, Mrs. Dalloway said she would buy the flowers herself, announcing her joy at engaging in the world in small ways. Ways denied to her before. We can probably all empathize with that. So in the first days of the stay-in-place orders made necessary by the coronavirus pandemic, there were many anxious variations on this famous opening line on cropping up on Twitter. March 16th, Mrs. Dalloway said she would disinfect the doorknobs herself. March 19th, Mrs. Dalloway said she would buy the hand sanitizer herself. March 23rd, Mrs. Dalloway said she would catch the virus herself. This was accompanied by a photo of a very crowded flower market in East London. And March 24th, Mrs. Dalloway said she would scroll through the pictures of flowers herself. March 31st, Mrs. Dalloway said she would have the flowers delivered because they were a non-essential need, but would make sure to tip the delivery guy at least 30% herself. And on April 3rd, Mrs. Dalloway said she would order from at Instacart herself. And finally, on April 5th, Mrs. Dalloway said she would make the mask herself. On the book's second page, a neighbor of Mrs. Dalloway's watches her and observes that she has grown very white since her illness. And in the next paragraph, we learn that her heart had been affected by influenza. Though the 1918 flu is never directly mentioned in the novel, literary scholars note any reference to influenza in 1925, especially one with continued serious side effects, would have evoked the pandemic. And key motifs in the novel, like the frequent ringing of bells, likened to leaden circles dissolved in the air, evoke the pandemic in subtler ways. One of the phenomena most associated with the 1918 influenza pandemic was the constant sound of tolling bells that rang for the victims. The ringing bells has resonance for us too. In my mind, not to toll for the victims, but the ringing of bells in solidarity and support of hospital workers. So Mrs. Dalloway is explicitly about the influenza pandemic. And at the beginning of this COVID-19 pandemic, my thoughts went to the film, The Exterminating Angel, which is a 1962 Luis Buñuel film, where a group of people at a dinner party find that they share a belief, they have a shared belief that they cannot leave the room with disastrous consequences. And I'm going to show a clip from a theatrical adaptation, a brief clip from a theatrical adaptation of the film. And I think I thought of this because of the sense of being stuck in place. Though luckily, as you will see, my family did not devolve in the dining room as these people do. So I'll play this for you. So that image came to mind of these people who cannot leave. They share this belief that they cannot leave, and that came to mind for me when we were first on stay-at-home orders. So I had read that the psychological influence of the 1918 or Spanish flu became intimately entwined with its physical effects. And while prevention efforts such as masks were employed, the combination of mental and physical debility together appeared to open the door to what people described as a second infection. And in a 1918 piece in the Illustrated Weekly publication Sketch, they described the flu as almost as much a mental disease as a physical complaint. And I found here an image that I thought was kind of interesting, promoting mask wearing from that era. It says wear a mask and has I don't know, I think it looks a bit like a duckbill, this mask. And it says, we appeal to your civic patriotism to cooperate with us in our effort. So that's feels quite familiar. I thought this one was funny too. I think this is in earnest and not humorous. They are trying to appeal to people to wear masks when kissing, and that an unmasked kiss is a germy kiss, and that a masked kiss is a pure and germless kiss. This image may look very familiar. A group of young children outside wearing face masks. This is a cartoon of the era, and I think it expresses a very contemporary sentiment. The man sitting down says, there's a man sitting down wearing a mask and then a man kind of towering over him in a suit. And the seated man says, I think it's everybody's duty to help combat the spread of contagion. And the standing man says, well, I don't think these muzzles do any good. If a person's got it, if a person's going to get it, he's going to get it. And I'm going to take my chances. And then the other man, the masked man, stands up and says, well then, take a tip from me, wear one and improve the looks of that face. You owe that much to the community. So even though the language is a little old-fashioned, the sentiment is certainly contemporary and speaks to mask objection and protest that was present then too. There were all kinds of curatives recommended for the influenza itself and the malaise that accompanied it. There were some who recommended cycling as a mental tonic, and this was a bicycle ad of the times, bicycling versus influenza. Very few of the people who've had influenza are regular cyclists. Those who bicycle regularly have been less liable to attack. The clean, sweet air on the road is far healthier than the stuffy atmosphere inside the tram, the bus, or the train. And with a pair of Dunlop tires fitted to your machine, you're free from tire worry. Who knew that was a thing, tire worry? And you've reduced the actual effort of cycling to the minimum. So buy a bicycle and Dunlop tires in order to avoid the pandemic. And we know that I don't know that there were any bicycle ad campaigns promoting bicycling to avoid coronavirus, but bicycles were few and far between and hard to come by for the last year and a half. Another one for a bicycle: ride a bicycle and keep well. As a precaution against the influenza, I don't know that bicycling actually prevents flu, but it's not a bad thing to do anyhow. Keep out of the crowds. Well, that's reasonable. Ride a bicycle to and from your work, and so on and so forth. Every man who lives a sedentary life needs a bicycle. And there were popular articles saying that one needed to lift one's spirits and go to the theater. Some recommended attending the theater as a means of mental healing. Though, of course, many theaters were also shuttered, and this picture shows a theater repurposed as a hospital in Oakland, California. According to a tongue-in-cheek piece in the Tatler, a magazine aimed at high society, or so I read, a new dress and new hat, along with the necessary treatments and tonics, goes a long way to getting over the dreadful convalescent stage. And so here are some pictures of fashionable people, fashionable hats and dresses of the era, as is recommended by the Tatler. Some other fashionable ladies and more fashionable ladies of the times. And last but not least, onions were put forward as a curative for the flu. I cannot read all of this without squinting, so I'll say a little bit of the poem about onions that they put in their ad. Eat more onions. An onion car arrived today, labeled red, white, and blue. Eat onions plenty every day and keep away the flu. Who knew? Foregoing conventional medicine for folk remedies is really nothing new. Conventional medical advice, and this is the conventional medical advice for influenza at the time, included morphine, atropine, aspirin, strychnine, belladonna, chloroform, quinine, and kerosene, which apparently I read was administered on a sugar lump. I don't know what these things were supposed to have done, but those were conventional medical advice at the time. And alongside these, unsurprisingly, folk remedies thrived. I read that one of the popular folk remedies in South Africa was to place a block of camphor in a bag and tie it around someone's neck. Yuck. But none of that sounds very appealing. It makes the bicycles and onions and fancy hats look good, right? So when this pandemic began, I had my own reactions. First, I ate an entire pint of ice cream for dinner one night. In my defense, it was on sale for $2.50, economical. And ice cream has milk in it, which we could think of as wholesome. Also, I did not need to wash a bowl, so that was labor saving. There we have it. And now a year and a half later, I'm really curious how my own responses fit into expert advice and other people's responses. So these are my kids in my kitchen. Like the rest of the nation, I baked a lot, and which I found out everyone else was doing when I had trouble buying baker's yeast. These are baguettes and my kids being silly, about to devour them. More baking, I baked a lot, cinnamon rolls. And then I had a sort of curious experience. My kids had an assignment for school to do self-portraits and upload them online. And actually it was an assignment for all of us. They asked that whole families do self-portraits so that we could put together an online family community portrait, a virtual community portrait. So we all sat down and did self-portraits, both individually and some of them collaboratively. And here are some of the ones we did. And this experience reconnected me to engaging in artwork, which I actually hadn't done regularly since I was in my teens, but I did really seriously at that time. And it connected me to that just at I think at the right time, and gave me a tool to deal with the global changes that we were all experiencing. So I started drawing my own experience. This is a self-portrait I did after jogging in a really, really empty city. And then I got home and did a self-portrait. I did this one after my first day of Zoom clinic. I can't hear you. I think you're on mute. Can you hold the iPad steady? I can't see you. Anyway, that's all reflected here, I think. I drew my kitchen. This is a little blurry. Sorry about that. I drew my kitchen. And I drew Zoom calls. This is a Zoom Passover Seder. Everybody has their own little square because we could not be all in the same place. So we had a Zoom Seder, actually all around the world, and I drew our little windows. I drew my kids. That's my daughter drawing. That's me drawing her, drawing. And sleeping. And we hiked a lot, as I imagine others did. This is like, I think, a really lovely image of the top of a hiking trail, a mountain at dusk, but I will, in all transparency, tell you that my 10-year-old, pictured prominently there, or now 10-year-old, is now a conscientious objector when it comes to winter camping. She will not do it under any circumstances. So I enjoyed it, but not everybody did. I drew the presidential debates. Those may look like familiar faces depending on my skill, or maybe not. I drew colleagues. Apologies to my American Psychiatric Association colleague whom I captured here. And for myself when no other models were available. I drew on hikes and painted. I finally bought my own paints rather than borrowing my kids' watercolors. And I drew my kids more. And that's me again. And that may look familiar. That is Lake Champlain. And that's another view of a tiny kayaker on a lake. So what can we learn from individual responses, and how do we support adaptive responses and resilience? So I actually found that the CDC has some really useful advice on this, how to individually shore ourselves up and support adaptive responses. So it's really important to take a break, to unwind, do things that are enjoyable and nourishing. For some of us, that's yoga, music, gardening. For me, drawing and painting, or new hobbies. The CDC also recommends finding ways to safely connect with family and friends, get support, and share the experience. The image that the CDC had is the one in the lower right of somebody waving on a Zoom screen. My gut response to that was to chuck the computer, like I had images of chucking the computer across the room, no more Zoom, though obviously I didn't do that. So I added some pictures of enjoying the out of doors with friends. It's also really important to take care of your body and get moving. And this can help us manage fatigue, anxiety, sadness. And to treat yourself to healthy foods and get enough sleep, treat your body well. As I talked about before, to seek out mental health care when things are not getting better, because it can be life improving and life saving. So thank you everyone for your attention today. I will move to questions and comments, and thank you.
Thank you, Dr. Ravven. That was excellent. And what I was thinking of throughout was that history really repeats itself over and over. We're human beings. So much to learn from the past, and also figuring out a way to forge ahead.
I find it reassuring to read that we've been here before in some ways, and and recovered, and I find that really reassuring.
Agree. And you do have a number of questions, and I'm going to go through them and read them aloud, and then let you go ahead and answer. Sure. The first is, many of us are retired but still need to be active, contributing people. How can we volunteer in the field of mental health to support problems families are facing? Please go beyond food insecurity and transportation.
Well, that's a really, really important question and comment, and speaks to the need to, our individual need to contribute, but also the enormous amount that so many people have to contribute, and the positive impact that can have. I do have to say, I'm not an expert on volunteer opportunities and connections, so I don't have precise advice on that. But you touch on something so very, very important.
Thank you. I could just add too, just knowing in this area, Front Porch Forum might be a nice way to reach out to your neighborhoods. There may be folks in your local community who could use support that might go beyond what you're suggesting, food insecurity and transportation, and you may very well be able to extend a hand and feel really good about that. Let's see. Next question. Interesting that there was no data collected on unpaid caregivers of children and single parent households, etc. If there is any particular reason that you can think of for why that is, and I wonder if there will be in the future.
So that's really important, and they commented on that gap in the data, and it's largely because of what the data had collected in prior years before the pandemic, but for that particular CDC data set. But there have been plenty of other surveys looking at the toll on unpaid caregivers of children and parents generally, and see enormous stresses in that population. So I think it's probably not dissimilar to unpaid caregivers of adults, but the CDC data had not been collecting it before, so they did not. But I think it's probably pretty similar.
Thanks, Dr. Ravven. Here's a comment, and then I'll follow with another question. I wanted to say that I appreciated the title of your talk. The resilience in a time of unrelenting uncertainty aspect felt spot on and therapeutic just reading those words. That's the comment. Here's a question. What is the best way that we can help those that are caring for others?
Well, that's sort of what is the best way that we can help those who are caring for others? I think that's a wonderful question, both a practical and a philosophical question. The first thing that comes to mind is if you're close to people who are caring for others, being an ear, a support, a friend. But you may mean the question asker may mean more broadly than that as well.
Thank you. Here's another. Being a working mom, I have found it really hard to find time to engage in new hobbies or even existing hobbies, with trying to balance having sick kids home for what feels like days on end, and then also trying to work at home while also maintaining a household. Do you have suggestions for finding balance with that?
I only laugh because I think that, like, work-life balance, especially for working parents, I don't know, I call it like the unicorn, like that thing that is elusive. I don't know that I have wonderful advice on finding work-life balance. I'm also a working parent, and it's always a moving target, and sometimes are better than others. That's off to you. Work you do, especially. I think the video cut out for a sec, but I think that Denise commented on briefly on monitoring at-home school. Was that, or did I elaborate on that?
Yes. I'm sorry.
Okay.
I wasn't following you there for a moment.
Okay.
Yes, just finding the balance in all of it, all of the competing demands.
I'll give you my own personal advice, which is the house doesn't need to be all that clean. I hope, as long as the health department isn't going to come, it's good enough. Peanut butter and jelly makes a good supper. I like to find activities that I enjoy and my kids enjoy, so we'll do things together, and that can be helpful. So it feeds the soul and is something that you can do while you're taking care of kids. So those are sort of personal tricks that I've found. The other one, which was that picture of my kiddos on top of that mountain. We have made a habit of doing short hikes for dinner. We'll bring hot cocoa and peanut butter and jelly, climb up the mountain, eat our supper up there, and then climb back down, which can feed the soul and make supper all at the same time.
Thanks, Dr. Ravven. Your presentation talked about people seeking mental health care, but a lot of folks have not been able to find mental health treatment. And you did talk about it. The accessibility was hard even before COVID. There are no providers available. They're busy or have stopped working during the pandemic. Can you comment any further on that?
I can comment to say that you're entirely right. In Chittenden County in the Burlington area, we're relatively well resourced, but there is an enormous demand, and they're nationally and in many areas of Vermont, we don't have the supply to meet the demand. one of the things that the pandemic has opened up is more remote mental health care. And for many, seeing someone remotely by Zoom has become an option. So geography has become less of a barrier, but that's absolutely right. The demand is outstripped, like before the pandemic, but more exacerbated, outstripped the supply.
Here's an interesting comment and question. Support systems have been greatly impacted. We've talked about that during the pandemic, and in many cases they still are. How does one access support for the many losses when those that they usually access support from may be one of the last losses? So when a family member or a friend has passed or is no longer able to provide support, do you have recommendations for that?
I think that people are really commenting on some of the challenges that we're really experiencing, that we've had, both individuals have had losses by death or illness, and we've had losses of the sort of cohesiveness of a lot of our social structures brought on by social, distancing, and how we don't come together and can't and haven't been able to for quite some time in the same way. So it's an enormous challenge to make new connections that are supportive, but really important to do so as much as we can. I think reaching out to people in our lives and to new people is really important as much as we can.
Thank you. My name is Jackie, and I have a number of affiliations with Howard Center. My major concern has been for the kids who have had to be homeschooled in homes where they are at risk for any type of abuse. School was a sanctuary for me. I was harmed psychologically. What do you know about what's been done to address that during COVID? So
I do know that the American Academy of Pediatrics and the Vermont Medical Society and the Agency of Education have really emphasized back to school and the importance of that, and safely bringing kids back to school. And that serves a lot of purposes, both having an environment where kids interact with adults, teachers, and other adults who are looking out for them and can have eyes on difficult or abusive situations that may be happening outside of school, and all the other important and enriching both academic and non-academic elements of school. And I think that that's one of the most important things we can do, is to support safe back to school.
Thank you, Dr. Ravven. Many children have lost caregivers, a parent, grandparent, uncle, aunt, neighbors to COVID. Since there's such a shortage of licensed therapists for outpatient care, both in Vermont and really around the country, what other resources are there? Hotlines, groups, living rooms, the storefront type of living room set up where people can go to talk? Wondering if Howard Center can try to set those up.
Great. This is a really important question. I don't have those resources listed at my fingertips, but I'd be happy to share and do a bit of research and share those after this hour.
Great, thank you. I think we've got time for a couple quick others. Here's one. How did you find kid-friendly hiking trails for locals in Burlington?
By asking, and mostly just asking people what hiking trails they liked with their kids. I think it's important to take it with a grain of salt when you're talking to people who have very athletic or eager hikers in their family.
And I can just mention a few. I walk a lot here in town: Red Rocks, the Intervale, Eastwoods, Centennial Woods. There's a number right in town, and then some really close by, like Mount Philo, Shelburne Farms. I think all of those are free. Next, thank you for this. Would you mind sharing the author's name of the New York Times article that you referenced at the beginning of your talk?
Sure, I'd be happy to. Let me find that for you. because I do not remember it off the top of my head. That is Andrew Solomon. Thank you
Great.
for asking.
Okay, here's a comment too that I'd like to read from our friends over at the United Way. A follow-up on the question about volunteer opportunities. The United Way of Northwest Vermont hosts an online volunteer connection site where nonprofits post volunteer needs, and people interested in volunteering can find opportunities. So check out United Way Northwest Vermont .com, and you'll be able to access that. So that's for the question that we talked about in the very beginning.
Wonderful. That is so helpful. Thank you. I see that just came up. United Way NWT.galaxydigital.com.
I think we can take one more question, and it's a question that I think has been on everyone's mind about mental health visits in the hospital EDs, the wait times. It's been especially concerning when you look at the number of children's waits. What do you think could help to address this quickly?
I think that, I think that statewide increased investment in children's mental health services will help prevent the need for this kind of emergency care, that if we can get more supports to kids across the state to prevent this kind of intensity of need that necessitates emergency visits.
Thank you very much, Dr. Ravven, for your time today. It was really great to really introduce you to our community. Just looking ahead, we have Ashley C. Ford, the second of 4 in our weekly speaker series. She'll be here with us next Wednesday, the 13th, from 4 to 5:15. Should be an excellent conversation hosted by Dr. Jude Smith-Rakelli. So hopefully you can join. We will be sending a feedback survey. If you'd be kind enough to just take a few minutes to complete that, that would be great. And this Sunday we'll be on the Church Street Marketplace from 11 to 2 with resources and giveaways in recognition of World Mental Health Day. So really appreciate everyone participating today, joining us through their lunch hour. Again, thank you, Dr. Ravven, and we'll see you next week.